Hello, our first presenter is Aakriti Dave. She is a dental student at Pitt Dental. She's originally from New Jersey and she's the outreach chair of SAS. She loves working out, reading, and baking on her free time. She also has Rucha Tank with her. She is from Pennsylvania and also is a dental student at Pitt. And she is interested in pursuing general dentistry. So those two will get started for us. And then after they're done, we'll have Dr. Aggarwal, who is a dental specialist, maxillofacial prosthodontist, who works with cancer patients to help restore oral health, comfort, and confidence. She specializes in caring for patients who have or are preparing to undergo surgery or radiation affecting the mouth and face using a combination of conventional, modern digital, and implant-based approaches to improve speaking, chewing, and overall quality of life. She makes intraoral prosthetics such as orbitors and facial prosthetics also. In addition, she also provides care for patients with congenital conditions such as cleft lip and palate, and has extensive experience rehabilitating children with retinoblastoma using ocular prosthetics. Thank you.
Okay, can everybody see our screen?
Yes.
Okay, perfect. So yeah, I'm Aakriti. I'm a second-year dental student at the University of Pittsburgh. And then we also have some more dental students on the call. So Leena and Vidhi are also going to be presenting a little bit, a little while later on in this presentation. But essentially, today we just wanted to provide a quick overview of the unique oral health risks that cancer patients can face as a result of what they're undergoing for treatment, talk about some oral hygiene techniques to reduce negative oral health outcomes, and offer some suggestions of what you can ask your providers in terms of dental care and how it relates to your other medical care. So just to start off, we have just a list of some of the unique oral health risks that cancer patients might face that some of our other patients don't typically face. So for example, one of those things would be bone modifying drugs. Certain cancer patients might be on treatments that involve drugs that could be bisphosphonates, and they might be breaking down some of your bone, and that can be an issue when it comes to your oral health, especially in your mandible and your maxilla. That can cause an issue and maybe make it harder for you to maintain a healthy smile. And I won't talk too much about the radiation to the head and neck because Dr. Aggarwal is actually going to talk a lot about that, and she knows a lot more than we do. So I'll leave that to her. The other thing is stem cell transplants. So sometimes cancer patients receive stem cell transplants, and that itself already, it can be kind of a tricky process to make sure that everything lines up. But at the same time, the autoimmune effect, it could also have an effect on your oral health, and it can lead to an increased risk of certain diseases and bone loss in your mouth as well. Another unique risk could be vomiting from chemotherapy treatment. So when you're vomiting, that's a lot of acidic stuff that's kind of compiling up in your throat and on your teeth, and it's basically eroding some of your enamel, which is like the outermost layer of your tooth. And that can be an issue because it essentially leads you more susceptible to other diseases like breaking down the tooth. So then you're getting bone and then tooth loss. Another one would be xerostomia or dry mouth.
Sorry to interrupt, but I think the slides are not proceeding.
Oh, here.
Yeah, it's like you're on the first slide.
Let me see. Okay, we're going to share it again. And then if you don't see it, let me know. See? Okay. Okay. Did everybody see that? Okay, perfect. Okay, so those are just some of the ones I was talking about, but now you can actually see them, so you'll probably remember them more. The other one was dry mouth. And so if you have dry mouth, this can increase the likelihood that you can get cavities because saliva is actually very protective for you. It can help keep certain bad bacteria away. And then just overall, when you're a cancer patient, you're more susceptible to have an increased risk of infection and delayed healing because of everything else that your body is going through. So that means that if you get an infection in your mouth, it might be harder to resolve than it would for someone else who had the same kind of infection. And then I think Leena is going to take over for this slide.
I'm also a second year dental student from Pitt Dental. Today I'm going to talk about some common oral health changes during cancer treatment. Aakriti talked a little bit about it on the last slide, but I'll just go into some more. So first is oral mucositis, which is basically when you have like ulcers in the mouth, and it happens around 5 to 10 days after chemotherapy begins. And those ulcers can cause problems with eating, speaking, and swallowing. And Akadi also talked about this xerostomia, which is dry mouth due to damage of the salivary glands, and it can just be a little bit just uncomfortable. You might have difficulty speaking and swallowing, and you have an increased risk for cavities in your mouth. There are some like over-the-counter options for like the salivary substitute that you guys could use to just increase that salivary flow. Also, you're at increased risk for infections, either fungal, viral, or bacterial. Commonly, we see like bacterial infections with periodontal or gum infections due to your reduced immunity. And then also, you can have limited mouth opening. And then going along with the xerostomia, just increased chance of tooth decay and gum disease caused by that reduced saliva. And then going on, we also have bleeding gums, and this is due to the low platelet count from chemotherapy. And you just might have more burning sensation or sensitivity within your mouth. And Akriti also talked about increased risk of vomiting from chemotherapy, which also can cause like some erosion to the teeth, especially on like the side of your palate. Taste changes, decreased ability, so it might change your ability to taste food, leading to like a poor appetite and nutrition while you're receiving chemotherapy. You have delayed healing oftentimes, so the mouth, like the ulcers in the mouth and just like wounds in the mouth may heal more slowly after procedures due to your immune suppression. And then lastly, oral tissue fibrosis after radiation, which is basically just the thickening and hardening of the soft tissues in your mouth, which may affect speech, chewing, and comfort.
I'm Rucha, and I'll discuss some oral hygiene tips or techniques. So, for starters, you should brush your teeth at least twice a day. You can floss once a day, and then also using a mouthwash can help if brushing or flossing is a little bit troublesome. Brushing your tongue or using a tongue scraper can also help with xerostomia. And then obviously going to routine dental exams or cleanings, and then avoiding smoking and using other tobacco products, and then eating a healthy diet can help maintain and keep a healthy smile.
Hi, my name is Vidhi, and I'm also a second year dental student at Pitt Dental. I'm going to discuss what you should ask your care team, whether that be your dentist or your oncologist. A few questions you could ask are, how can I prevent infections in my mouth during periods of low immunity? What is the safest way to brush and floss during treatment? Do I need antibiotic prophylaxis for dental work? And are there any procedures you think I should have done prior to my cancer treatment?
Okay, so that's all the information that we have, and we're going to turn it over to Dr. Aggarwal for a little bit more about the radiation part that we didn't talk about.
Are you able to see my slides?
Yes.
All right. So first of all, I would like to commend Cancer Bridges for the incredible work you guys do. Also, I'm grateful for this opportunity to speak with everyone today about oral health care during cancer treatment with a specific focus on head and neck cancer therapy. In this presentation, most of the side effects have already been covered by Aakriti, Rucha, and Leena. I will be talking about some simple steps how to stay comfortable when you have these side effects. There are many different types of possible cancer therapies which are used to treat different types of cancer, and each of them have benefits as well as side effects associated with them. Specifically talking about head and neck cancer patients who receive radiation therapy for head and neck areas. Radiation, it targets the cancer cells, but also it affects the healthy mouth tissues. Some of the side effects have already been discussed that can either be long-term side effects or short-term side effects. The long-term side effects are those which are going to last for the lifetime. Therefore, you have to be careful before the radiation therapy, during the radiation therapy, and following the completion of your cancer treatment as well. These changes are very common, but there are ways that your providers or we can help. And I will tell you all the side effects and how to manage them comfortably and safely. I do understand that most of the patients usually become overwhelmed with the cancer problem that they are facing, so sometimes dental care can become secondary for them. But why oral health care matters is because keeping your mouth healthy, besides helping you eat, speak, and smile, it also helps to keep your cancer treatment on track. If you have substantial dental problems, that can actually delay your cancer therapy. Daily hygiene habits and early dental care can help prevent pain, infection, and some serious jaw problems like the dead bone disease or osteoradionecrosis. During the radiation, the common changes which are seen are mouth sores, dry mouth, taste changes, increased risk of cavities because as the saliva is going down, the risk of cavities and periodontal disease increases. And another long-term side effect is trismus, that is jaw stiffness. Coming to mouth sores. Sores usually start about a week after radiation begins because the radiation effects are usually cumulative in nature. If the patient is undergoing concurrent chemotherapy as well, then these side effects are much more pronounced in the patients. The mouth sores usually subside within 8 to 10 weeks after the completion of the treatment. Your dentist or me, like Maxillofacial prosthodontist, may prescribe you a numbing rinse, a mouth rinse which is known as a magic mouthwash to alleviate some of the symptoms caused by these mouth sores. Other things that can be used are mouth rinses such as chlorhexidine, antibacterial lozenges, which can help reduce the severity of mucositis. Dry mouth, also referred to as xerostomia. So once the radiation basically reaches in high dosage at a dose of around 24 gray or greater, there are changes in the volume, viscosity, that is thickness of the saliva, the pH, its potential buffering capacity, and its composition. Saliva becomes thickened, reduced, and if the radiation dose is more than 55 gray, then usually the salivary glands, we call them, they are fried and there is no longer any ability of the salivary glands to produce the saliva. There are different methods which we suggest to the patients, like sipping water frequently, using the salivary gels or artificial saliva substitutes. However, we usually emphasize on using the fluoride for the lifetime, like use of fluoridated toothpaste, etc. Taste changes. Taste changes are usually transient side effects, and some patients tell me that their mouth tastes like a cardboard taste, and some patients tell me that it's very metallic, or some patients do not taste anything. Most of the patients, however, improve few months after the completion of the therapy. At this time, they may dislike favorite foods or start enjoying new ones as well. This is also very common. So most of the times working with your care provider team and a dietitian who can suggest you a soft diet can help you feel good and at the same time provide you enough good nutrition. as stated previously, the risk of cavities increases like many folds after the radiation therapy. So you have to commit to strict hygiene and frequent dental checkups. Many clinics usually recommend, and we also recommend, that you should be seeing your dentist every 3 to 4 months rather than a 6-month or a 1-year follow-up protocol following the radiation therapy. Radiation can sometimes, or most of the times, I would say, it can tighten jaw muscles, making the mouth opening harder. Some of the more severe cases which we see have a mouth opening of usually 10 to 15 millimeter, where you cannot even, do proper hygiene. So regular stretching or finger stretches can usually help to provide some mobility to your jaw and can help you eat, speak, and receive dental care. Some other methods which we suggest is using tongue blades or TheraBite. So you can stack up the ice cream sticks or the tongue blade and start pushing them. And this you can do either during the radiation therapy or immediately following the completion of radiation therapy. But the benefits are usually greater if you start as early as possible. And generally, we advise patients to follow rule of 7. That is that they have to do these exercise 7 times in a day, all 7 days a week, usually in the repetition of 7 cycles. And you should hold these tongue blades for 7 seconds in each cycle. During the radiation treatment, the daily care should be using soft toothbrush, using a high fluoride toothpaste, and usually it is recommended that after brushing the teeth, you should spit out all the toothpaste. However, you should avoid rinsing with water. Gentle flossing if it is comfortable. Use of alcohol-free rinses, sipping water frequently, as previously stated. Another helpful rinse which my patients told me is very effective for them is using baking soda rinse. That is adding 1 teaspoon of baking soda or sodium bicarbonate in 1 liter of water. And they can use often if they can tolerate it. It helps in neutralizing the acids. And always you have to remember that it's just an adjunctive therapy. It's just a helper, but it cannot be a replacement for the brushing, which is a must. You should focus on soft, moist foods which are easier to eat, such as soups, smoothies, eggs, oatmeal, etc. At this time, it is very important to avoid tobacco, alcohol, and spicy food because the oral cavity already has so many ulcers and erythematous tissue, as it can also irritate and worsen your dryness. Some of the prescription toothpaste which we prescribe to our patients include Prevident or Clinpro 5000. Prevident, usually the toothpaste contains only 0.12% of fluoride, but after radiation therapy or a combination of chemoradiation therapy, we usually prescribe 5000 ppm of fluoride toothpaste. We can also make custom trays, which are almost similar to the bleaching trays, and add the fluoride gel to these trays so that you can wear them for 5 minutes continuously, and it has been found to be more beneficial. So this was during the radiation therapy. What after radiation therapy? So for this, you have to be very proactive. You should plan your dental visits regularly at frequent intervals. You should emphasize on frequent cleanings and exams so that we can prevent, small problems from becoming too big. One most serious warning or most serious consideration is tooth removal after radiation. Generally, the tooth which are in the area of irradiation or irradiated jawbone should not be extracted following the radiation therapy. Extractions after radiation can usually lead to a serious jaw problem, which is known as dead bone disease or osteoradionecrosis. Therefore, you always need to consult your radiation specialist, dental specialist, or a maxillofacial prosthodontist before getting any tooth extracted or any implant placed after the completion of your radiation therapy. Generally, the patients who receive high dose of radiation, such as over 65 gray, are at the highest risk of this osteoradionecrosis problem. Usually, maxilla is at lower risk than mandible. I will say 90% of the cases which we see are usually in the mandible because that's in the densest bone of the body, the lower jawbone. These are some of the examples of the patients which we see, where all the patients who received radiation of more than 65 gray have developed dead bone. in order to prevent the serious complication of dead bone or ORN, osteoradionecrosis, it is always better that we see the patients before their cancer therapy or before their radiation therapy begins for a pre-radiation therapy dental evaluation, where we can actually check the teeth. And if we see that there are any teeth which are problematic or may become problematic 5 years down the line, we actually advise all those teeth, bad teeth, to be removed beforehand in order to prevent this complication. But sometimes, in some cases, the extraction of tooth, the need for the removal of the tooth may be unavoidable. In these cases, we can actually talk to the radiation oncologist and get a report from them, which is referred to as a dosimetry report, which can tell us where this high radiation dose, got to the bone or which areas are spared. And we can therefore make an informed evidence-based decision making, whether it is safe to extract that particular tooth or it is better to leave the tooth as is. Some places also recommend using pentoxifylline, which is a vasodilator, which can actually increase the blood supply to the lower jaw bone, and vitamin E, which is an antioxidant, to help prevent this problem. Certain places also offer hyperbaric oxygen therapy, such as shown in this figure, but this is very expensive. And other approaches like using medical support with pentoxifylline usually works equally well for these cases. What about if you are wearing dentures at the same time when you are having your cancer treatment? During radiation, most of the patients, because of the mucositis and ulcers, they are not able to tolerate dentures. However, if you still, prefer to wear dentures, you should always handle the soft tissues gently. You should consider on eating foods which are very soft and which will not put a lot of pressure on your tissues. Most of the times, we actually recommend patients to stop wearing dentures because there is a high risk of developing dead bone disease because of trauma caused by the dentures. Following radiation, suppose you have completed the radiation therapy. After radiation therapy, most of the patients have substantial bone loss, and there are changes in the oral mucosa, like it becomes less keratinized and the thickness also reduces. So we generally recommend a new denture for these patients, but only after waiting for a period of 6 months or so that the tissues get adequate time to heal. And it is very important not to hurry up or insist your dentist to make new dentures for you immediately after completion of your radiation therapy. We are always happy to help you, but not at the cost of risking your jawbone to another complication. Some salivary substitutes that I have found beneficial for my patients include use of biotin, which comes in the form of lozenges and the form of tablets or sprays. For many patients, sprays usually work well in order to mitigate the side effects of xerostomia or dry mouth. There are certain important things to watch in your mouth after the completion of your radiation therapy, such as fungal infection or candidiasis. You should be looking for any burning or soreness in your mouth. Your dental team can usually prescribe you antifungals such as nystatin mouthwashes for 2 weeks, which can help treat candidiasis. Also, soaking your dentures in antifungal solutions can be helpful in order to reduce the fungal growth in your dentures. So these are the general side effects and an overview of what we can do to help you before, during, and after your radiation therapy is completed. But what is most important is you should always call your dental care team if you experience severe mouth pain, soreness that stop you from eating, if you have high fever or pus discharge from any area of the mouth, or trouble opening your mouth. Early attention means faster relief and also safer treatment. Besides all this, as a maxillofacial prosthodontist, we can also make specific devices such as positioning stents, shielding stents, radioactive devices, radioactive source positioners, or tissue bolus devices if you're referred to us by a radiation therapist, and if he thinks that these devices can help provide uniform radiation dosage to the oral cavity, then we can make them for you. The most important key takeaways from this presentation will be oral dental care is a part of cancer care. Small daily actions can protect your teeth, can improve the comfort, and also ensure treatment success. You need to be proactive. You need to brush after meals. use fluoride without rinsing, stay hydrated, stretch your jaw whenever you can, and visit your regular dentist every 3 to 4 months. Most importantly, if you forget everything about this presentation today, just remember you need to avoid extractions and any implant placements in the irradiated bone following the completion of your radiation therapy. So we are open to questions if you have any. Thank you so much.